Welcome, everyone. Thank you for joining us today. My name is Rachel Massey, and I'm the Senior Science and Policy Advisor with CHE, the Collaborative for Health and Environment. Please feel free to introduce yourself in the chat if you'd like to. This webinar is hosted by the EDC Strategies Partnership. The partnership members include Healthy Environment and Endocrine Disruptor Strategies, or HEEDS, a program of environmental health sciences, Commonweal's Biomonitoring Resource Center, the Health and Environment Alliance, or HEAL, and CHE. We invite you to type your questions in the Q&A box at any point, and we'll get to as many comments and questions as we can after the initial discussion. If you'd like to activate closed captions, you can do that by clicking the button at the bottom of your screen. This webinar is being recorded, and it may last for up to an hour. This is the first in a series of conversations related to ongoing changes at the federal level. These conversations will include a variety of opinions and perspectives. As with all of our webinars, opinions expressed in these webinars are those of the speakers and do not necessarily reflect the views of the organizations in the EDC Strategies Partnership. We are very grateful to have Dr. Linda Birnbaum speaking with us today, and we really look forward to this important conversation. I'll now hand it over to our moderator, Dr. Jerry Heindel, Director of HEEDS.
Hi, everyone, and welcome to our webinar today. Today, we're going to discuss the changes the current administration is making to NIH, its scientists, the science, and the grants. And we're going to do that with Dr. Linda Birnbaum. And of course, Linda is the perfect scientist to have this discussion with. She is a former director of NIEHS and the National Toxicology Program. And that is the part of NIH that focuses on the impact of environmental chemicals on human health. So she knows the science and the politics of NIEHS and NIH. And she also knows a lot of the EPA, as she was the section chief there for more than 15 years. So today there's not going to be a formal presentation, but I'm just going to ask Linda some questions so we get her thoughts on what's happening and what we can do about it. And finally, if there are any opportunities out of all this gloom and doom we are witnessing. I thought I'd start with just a few thoughts as what happened under other administrations. So I worked at NIEHS for 25 years. And I remember a time when travel was restricted, when we were not allowed to hire new staff, when funds were really tight, and when the NIH budget was doubled. And funding was also restricted due to a continuing resolution. But notably, no administration has sought to control the science, the scientists, free speech, publications, or the focus of grants, except for one ban on the use of human fetal tissues across the NIH that they had for some years. So today, science in the US is in a place it's never been. Until now, there's always been bipartisan support for science and the work of NIH. Indeed, the NIH budget has doubled over the last 10 years. But now there's a dramatic change. It's impossible to keep up with all of the changes, but I'm going to list a few of the changes, and I put them into some categories to make it a little easier. First, some NIH-wide changes. That starts with the indiscriminate firing of thousands of scientists across the NIH with no reason except they were recent hires. A shutdown of grant reviews, which was temporary but very disruptive. A shutdown of the Institute advisory committees, again temporary but very disruptive. A complete travel ban, which has now been rescinded. A DOGE approval of all purchases. The NIH Clinical Center has lost key technicians, physicians, and administrative staff which has led to the patient population drop by 30%. Career staffers in the director's office have been replaced with political appointees without research grant experience. A proposed cap of 15% on indirect cost for grants. Forced resignation of some top NIH officials, and severe restriction of several centers, including the National Center for Complementary and Integrative Health. At NIEHS, the NIEHS strategic plan was removed from the NIEHS website. And environmental health sciences, the prestigious NIEHS journal has stopped reviewing publications. And it's likely that that would be a permanent hiatus. There's also changes to grants and control of science. There's been a shutdown of any grants with the focus on DEI, a bar on any funding that touched on DEI, and that led to 800 grants being rescinded. There's a list of words that are forbidden by the administration that if you use them, it will flag your publication or presentation for review. Words like female, disability, LGBT, gender, minority, racial justice, women, and racism, to name just a few. There's been a block of NIH grants to some universities and a decreased funding of $2.3 billion over the first 100 days. And virtually all of NIH training programs have been eliminated. There's also control of scientists, harassment of scientists. One high-profile example is Kevin Hall, an eminent obesity researcher who was forced to remove his name from a recent review and interfered in the publication of his recent work and interaction with the media because the results didn't fit the administration's review and view. Finally, the president's budget for 2026 calls for a 40% decrease in NIH funding. So that's already a long list of changes that have occurred. But let me start by asking you, Linda, do you know of other things that I forgot that we should mention that are important?
I think the complete chaos and resultant confusion, the wanton destruction, and the cruelty are things that are important to be aware of. I don't understand it. I do think there is a total lack of control at the level of people you would normally think are making the decisions, like the new head of NIH, Jay Bhattacharya. I don't think really he has had any control certainly in the RIFs, which are the reductions in force, in the firings of people. I don't think he's had any control in what the budget's going to be. I think he will have some control going forward in areas of research which are favored. But I think the institute directors really don't have control over what's going to be happening to their institutes. I also, Jerry, and I'm not sure it's a correction or a clarification, but in the proposal, the leaked proposal of which institutes were going to be cut, so the National Institute of Minority Health and Health Disparities, the National Institute for Nursing Research, the National Center for Advancing Translational Science, the National Center for Complementary Medicine, All of those are on the chopping block, which I think is a very sad situation. And I know, Jerry, this might be something you wanted to ask about later, but the proposal is to move NIEHS out of NIH into a new office, which would report directly to Secretary Kennedy, called AHA, which I believe is Administrative Health. Trying to remember what the other A is for. It goes along with MAHA, Make America Healthy Again, and in part would be composed of NIEHS, the remnants of NIOSH, and I think many of you know that NIOSH has been cut over 80%. NCEH, the National Center for Environmental Health, which is which has been part of CDC and also has been dramatically cut, but that is the group that does the biomonitoring work, and the Agency for Toxic Substances and Disease Registry. Whether this happens, we do not know. But this is a proposal that's going forward. So I think Jerry, you captured things quite well. I think the cuts in the NIH Clinical Center are devastating. The need to treat very sick patients. I think there have been many clinical trials done at major universities, which have been cut or suspended. We know that many universities have total hiring freezes. We know that there have been rescinding of certain graduate student or postdoctoral offers because people just were not sure of the funding. So as I said to begin with, there's chaos, there's confusion, and there's terrible concern about the future of research in our country.
So is there any logical reason for reducing NIH funding? Is it just DEI, or is there something else behind it that you know about?
Well, I think there are a couple of things. I think one thing is the president's budget is calling for major cuts in federal spending. Cutting people doesn't gain you a lot of money, but that's what they've been doing because it's visible and it's relatively easy to be done. I think the cuts of NIH, maybe we should feel a little lucky compared to NSF, where the proposed cuts are 60%. I think NIH, the proposed cuts across the board are about 35%, actually, not 40%, which is still horrific. But we know that there are huge proposed cuts also to NASA, to NOAA, to the interior. I mean, across the only part of our government that is proposed to increase its budget is defense. I do want to make one clarification. I think, Jerry, you talked about how basically from 2009 to 2023 or so, the NIH budget nearly doubled. It went from about 27 or 29 billion to about 47 billion. I think it's important to realize that most of that was targeted increases, which is not the way NIH budgets used to increase. If you look at the doubling that occurred from 1998 to 2003, it was kind of across the board. What occurred was Dr. Collins was very successful about increasing the budget, but it was by targeted funding, whether it was opioids or the cancer moonshot or brain or Alzheimer's disease. And I could list others as well. That all of us, for example, those were major contributors to the large increase. But I think it's important that those contributors were not, did not benefit all the institutes. And NIEHS's percent of the total NIEHS budget shrank.
So what do you think are the short and long-term impacts on the current and proposed changes to science, trainees, the next generation of scientists?
I guess one thing I would say is this too shall pass, but the damage that is being done will take much longer to repair than it does to destroy. And I think that we are going to lose another generation of young scientists. I think we're also going to lose a lot of established scientists because with the funding cuts, there's just not going to be opportunities. I don't think private industry has any interest in picking up the basic research. And I think that foundations, while they will do what they can, in no way have the budget of the federal government. I think it's important to realize that that the United States has been the leader in biomedical research for the last 50 years, or even maybe slightly more than that. And that is due to the federal investment. And as that federal investment goes away, we are already beginning to lose our leadership. I think many of you may know people who have already decided to leave the country. People are moving to get jobs in Canada, in Europe, in Australia. I mean, lots of places. And I don't think that it's something that we can or should discourage. I think it's important that science continues to go forward. And I think in time we will be able to resume the scientific agenda in a positive way. But at the moment, things are really rough.
Yeah. So let's look at NIEHS for a minute. So the mission of NIEHS is to protect Americans from toxic chemicals that cause disease. And the lack of a focus on social justice and social inequities in exposure to chemicals means that NIEHS will be prohibited from much of its research, especially even in children's health. So anything we can do about that?
Well, I don't, first of all, the mission of NIEHS, unless it's changed since I left, and I don't think the overall mission has changed, the mission statement is to understand what it is in the environment that impacts our health so that we can do something about it. And the environment is broadly defined. It's not just environmental chemicals. It's broader than that. I think that most of us know that in general, the people who are most impacted by environmental pollution, environmental stress are minorities, our communities of colors, our disadvantaged, our rural populations. And I think that there are ways that our grantees will be able to continue to address some of these issues. I don't think it will be as easy as it was under Trump 1. I mean, under Trump 1, there were also words we couldn't say. I couldn't put in a talk. I couldn't write about environmental justice, for example. It's just one of those 7 words. And there were other things, but there were many other things. And we couldn't talk about the health impacts of climate change. But under Trump 1, we were able to just change all our literature and our publications and ask all of you to talk about the impacts of climate on health, but not climate change. I think that going forward, there's some of the same of that things that are being done. So the NIEHS, the new strategic plan, which came out last year, was pulled off the web and was revised. And the sections dealing with DEI and climate change are no longer there. The climate change program, which was headed by Gwen Coleman, who many of you know, was a coordinated effort across about 8 or 10 different NIH institutes and was in part supported by a large $20 million that came from the department level. That's gone. And what I think the focus for NIEHS work and climate and health is going to be on wildfires, droughts, floods, that kind of thing, and their impact on health. So I think there are going to be certain things that we will be able to continue. I think if you're talking about the pollution, for example, I think the recent paper that just came out this week on formaldehyde and the fact that some of our African-American women are exposed to a whole bunch of beauty products that all contain formaldehyde. I think we can still talk about formaldehyde and its adverse effects, and we can use some of that as examples. So I think there will be some opportunities, but the budget is just going to be so much less that there are a lot of things that we're not going to be able to get done.
Okay, so you started a focus rather than on all the terrible things. Are there any positive signs and opportunities? And what kind of things have you seen that scientists, societies, journals are doing that is trying to help? Do you think they're going to have an impact?
Okay, so you've asked me a bunch of questions, Jerry. Let's see.
Yeah.
I'll do some of them, and you may have to come back and ask again. But for example, with journals, we know that a number of different scientific societies are writing and are publishing things. I know that many of them are talking to legislators. One of the reasons that NIH was always a favorite child across the federal government was that every congressman had at least one NIH grant in his district. And that makes a huge difference. Took me a long time to realize why EPA didn't have the popular support in Congress, for example, that NIH did. And that's one of the reasons. So I'm trying to remember all the different questions. I think that we've had a number of journal editors from Europe, and European journals write support. I think all that's good. I don't think that's going to get to DOJ. And I think it's important to realize, like I said before, that the people who are nominally in charge are not really fully in charge of what's happening. I think we need to realize that DOJ is still doing a lot of the cuts in a totally indiscriminate way. I mean, some of it is targeted. If it says DEI, it's a problem. If it says climate change, it's a problem. I did want to mention that EHP, hopefully it's not dead. Hopefully it's just asleep. And I think it was the funding for it had been for the contractors who provide a lot of the support to EHP has been cut. So there just isn't the staff to do what needs to be done. As well, I think, Jerry, as you said, kind of, I don't know if the word is antipathy or block of doing certain kinds of stuff made it very difficult for the journal to act with editorial independence. So I think at the moment it's kind of offline. Thank God it's still online, but lots of people have had papers that were somewhere in the review process returned. I mean, I had a paper that was in its second stage of review returned. So don't think that anybody was spared. But I think that that they've done the right thing. Now, let's go back to some of your other questions, Jerry. That was kind of the last one about the support.
Well, that covered most of it. So what about the university pushback? There's some of that, but I'm actually kind of surprised if there's thousands of universities, why aren't they acting more, in uniform? Because they're all being kicked the same way, but you don't see much of that.
Yeah, I agree. You don't see it. I think there's more going on behind the scenes than we know. I mean, I know, Jerry, you and I are both in North Carolina. I know that there's a lot of the universities are working with our local congressmen and senators, trying to support, get NIH and other agencies support. I think at this point, the current and overall administration is just not interested. All they want to do is see things cut. I think, of course, we know that there is targeting of the elite universities. There's also targeting and revenge going on against universities and researchers who supported CDC and NIH related to the COVID, what went on during COVID. And some scientists who feel that they weren't given a fair shake during that are kind of wielding their axe when they can. So I think that our elite universities may be suffering more than some of our smaller universities, although that's not totally true. But I think there is kind of revenge against what some people perceive as the elite.
Okay, so what message do you think would resonate most to kind of stimulate the public and Congress? You know, both Republicans and Democrats get these diseases,
Yeah,
but the
I,
focus.
I agree, Jerry. And I think from a cynical point of view, I've been not wishing, but thinking that when some key Republican congressmen or senators, that their wife gets breast cancer or their child gets leukemia or, you know, their father gets ALS, that will galvanize some action going forward. I mean, you know, everything is local in a sense and personal, and I think that's an important thing to realize. One of the questions you asked that I forgot about answering is where's there any hope? Are there any opportunities? First of all, one of the things that people are concerned about, and I'm concerned about, is the total reorganization that's been proposed of NIH. Now, I think that Harold Varmus wanted to reorganize NIH back in the 90s. Francis was trying to do some reorganization in about 2014 or 15. None of it happened. I think there are opportunities to possibly productively and positively reorganize NIH, but the way it's being done, that's not the way it's being done. But I think under the current administration, I think there may be some opportunities for NIEHS that we should open our eyes to. And that is Secretary Kennedy is an environmental lawyer. And he is interested in what he can do as far as the environmental impact, especially on children's health and chronic disease. I've had an opportunity to meet with the secretary, and he is aware of the complexity that we're dealing with. I think he is aware that many of the seeds for childhood disease and for chronic disease are laid early in life. I think he, despite some of his statements, he is aware that there are environmental strong associations with autism spectrum disorder. I think he is aware that ASD is not a disease and not one condition. You know, I think he knows more than he tends you necessarily hear, but I do think he is concerned with toxic chemicals, especially ones that, and in areas where he can have an impact. So he doesn't control EPA, so he can't regulate chemicals in commerce. He doesn't control USDA, so he can't regulate pesticides in commerce, for example. But he can, because FDA reports to him, he can make agreements with the food industry to remove synthetic dyes from food, which he has an agreement. Let's see how well it plays out, but hopefully it will. He's concerned about endocrine disrupting chemicals. He's concerned about PFAS. He is not going to step outside his lane, and he's not going to talk about petrochemical pollutants because this administration is committed to drill, baby, drill. So I think we need to look for opportunities where we can, where we agree with some of his concerns and try to support him in that and find things that get his support for the work that we want to do.
So I think that's a terrific a way to end this part of the discussion. That was actually my last question. I was going to ask you about what you thought of him, because he has given some speeches where he sounded almost like an environmental person, that he likes post-market review, improving toxicity testing, cumulative effect of mixtures and stuff like that. So I'm pleased that you can meet and talk to him and maybe have some influence on him, and that there could be some positive stuff come out of that.
I sure hope so, Jerry. I also heard him give a small talk. He's very concerned also, I should say, with plastics and microplastics. It's another area.
Okay, terrific. Well, this has been great. And now we have some questions from the audience.
Okay.
Says, what should be our main goals now? To get private funding for research? And how would we try to get more research from other places perhaps, or what?
Well, I think private foundations and private sources is great, but I don't think it can take over for the federal government. But I think what you can, that's great. I think I'm a big believer and have always been a big believer in collaborations. So if you have colleagues in other countries and you work together, there may be some opportunities from the EU Big Horizons projects. There may be some opportunities from the Canada's projects for collaborative funding that you may be able to get that way. But I think I don't see a way to totally make up the huge cuts that are being proposed. I think it's going to be a period of belt tightening. And what that means is people are going to be hurt, both people not having their jobs, people not having training, and are understanding what it is that causes disease. I think it's all going to slow down. Sorry.
So, so another question. Could there possibly be some new funding opportunities in some of the areas, like you mentioned, that the RFK Jr. is interested? The whole thing of Make America Healthy Again and the focus on children's health. That might be one opportunity. Are there other areas that, we could figure out that they're interested in that might provide some grant funding?
The answer is yes. I mean, I think listening to what he says and what he talks about, that those are the areas to think about. So I think microplastics, as I said, he's very interested in PFAS. Now we've got to, I keep saying we, guys, I have no control of anything anymore. I often think of the things I really would love to fund, but I don't have that control. So it's the royal we I'm talking about. But I think there may be coming, and I don't have any inside information, but I wouldn't be shocked that when some of the dust settles, and I guardedly optimistic that within a couple of months, some of the massacre will be over and we can begin to pick up the pieces. I do think that there may be some requests for proposals in specific areas addressing the things that the secretary is extremely interested in.
Well, that would be really terrific. A little light at the end of the tunnel here.
Mm-hmm.
So here's a person who says, I'm funded on 3 NIEHS global research grants. And now there's this ruling that you can't have foreign subcontracts. Anything that you think can be done about that? I mean, that sounds like something that they would like to do, stop money going to foreign places. So that's going to be hard maybe to overdo that, huh?
I think it's a real problem. And I think it's something, at least for a while, it's going to be a problem. I mean, the thing is, and, again, so much of work that is being done in science is being done internationally, and to totally block NIH funding of international investigators. I don't know what this means in terms of a lot of the epidemiology studies, for example, that are often done in foreign countries because you might have the appropriate populations to work with. I don't know what it means in terms of those kinds of studies. Um, uh, Somebody may have an answer for that, and if you do, please put it and let Jerry know so that he can read it.
Yeah.
But I don't know the answer. But this is all, this is all anti-science, is the bottom line.
Well, it's not only anti-science, but it shows they just don't understand science
That's
and
correct.
the needs of the scientists and scientific community to make progress. Killing
And
something like that, it's just,
well, I think we all know that the statement that the secretary made maybe a month ago, that he was going to solve what causes autism by September. I mean, I think we all know that that's not a possibility. We may find out, we may have some work that pulls together all of what we do know. And we know lots of things that are involved with an increased risk of people being on the spectrum. But the idea that we're going to know the cause, that's not a scientific possibility.
okay. So here's, I understand the pushes to scrub ban terms from grant proposals. And this person says he can see it at his own institution. Do you have any insight about publishing NIH-funded work in academic journals that used banned terms out of necessity? Is this threatening our future funding of the project and linked to maybe some changes even in PubMed systems?
Well, I think we're all concerned about PubMed because there had been some talk for a while that might even get shut down. I don't think that's going to happen. If you're an independent investigator and you've done a study that was looking at environmental justice, of course you have to publish it. But I can tell you that NIH scientists are not going to be able, from what I'm hearing, are not going to be able to publish that unless they change some of the words. I have not heard, and again, I have a pretty cloudy crystal ball or crystal headphones, that if you publish something that uses those forbidden words, it is going to impact your ability to get your next grant.
And the forbidden words are such common words we're used to using that makes it difficult.
Like
It's-
evidence-based,
Yeah,
science-based.
yeah.
Yeah.
So I want to go back to NIEHS possibly being moved out of NIH. All the while I was at NIEHS, there were talks that was going to happen and that industry was really pushing for that because it would, harm NIEHS and lead to less funding and maybe more control by them. But what you're kind of indicating that there could be, if they did it right, it might be helpful. Is that right?
Well, it's concerning. I think there are there have been, certainly until now, huge advantages for NIEHS of being part of NIH. There's a lot of support and interactions that go on with other parts of NIH. Now, there's nothing that says that some of that couldn't continue if NIEHS were still in HHS, but no longer in NIH. But from my point of view, what I'd like to see, if they really want to kind of meld us with ATSGR and the remains of NCEH and the remains of NIOSH, why not let those organizations join become part of NIEHS and NTP as part of and in NIH? To me, that would be the most, would be a positive outlook. I think I have heard the secretary say that he wants to enhance the National Toxicology Program. And despite what some people in NIH think, NTP is not part of NIH. It actually, when the director of NIEHS wears the NTP director hat, you actually report to the Assistant Secretary for Health and the Secretary. Certain NTP documents, like the legislatively mandated report on carcinogens, has to actually be presented to Congress by the Secretary of HHS. So, you know, there may be opportunities for NTP to be enhanced going forward, but it would make me very, very sad to see that happen at the expense of some other parts of NIEHS.
Okay, thanks for that. So one question is, you mentioned microplastics and PFAS. Is there any way we can get more into Kennedy's head on what other research areas that he would be interested in that would help fill some of these research gaps?
Well, we know certain other things he is interested in. He is interested in radio frequency radiation, cell phones and other things. He's interested in fluoride. And I think one area of fluoride that I think there are opportunities at is fluoride does things. We know topical fluoride is beneficial for teeth. Systemic fluoride is not. We do know that fluoride can affect the thyroid. We know that it can affect, for example, the kidneys. I don't know enough to know kind of at what levels this occurs. I think there may be some opportunities to understand that better. You know, I think understanding, again, what the secretary is interested in. When I met with him, I did give him a copy of the briefing paper that Tender, I think many of you know that that's the, I'm going to be terrible, toxic environmental neurodevelopmental research. What, I'm sorry, Maureen Swanson's probably going to be mad at me. You know, but Tender is a group that focuses on neurodevelopmental impacts and had prepared a briefing paper for the plastics treaty in Busan. And in that, I talked about the contaminants in plastic, as well as the plastic particles that, for example, get into the brain, cross the placenta, and so on. And I did give him a copy of that briefing paper, and he seemed very interested in that. And that did talk about endocrine disruptors, as well as a bunch of other things. So I think when there are opportunities to, I think we need to take advantage of opportunities that may exist. So for anyone who has an opportunity to meet with the secretary, from one way or another, I would definitely use it. It's not always comfortable when you disagree with some of their positions, but I think rather than going to head on things that you probably are not going to be able to change their opinion on, look for opportunities where you may have common interests.
Okay. So you said that RFK Jr. is not interested in petrochemicals because of drilling and stuff, but doesn't PFAS fall under that? At
Not
least
really.
somewhat?
Not
No?
really. No, PFAS is a, you know, you're linking lots of carbon atoms with lots of fluorine atoms. And the source for those carbons are often, they can be, they're organic materials, yes, or, you know, because by definition, carbon is organic, but they don't have to be petrochemicals. And I think that if you want to talk about the health impacts associated with fracking, I don't think that's something that the secretary at this point would be supportive of. I think if you're going to talk about the health impacts of wildfires, which may be driven by, and some of the health impacts may be driven by petrochemicals present, that may be okay. And again, I think at times how things are worded may make a big difference.
So what really falls under the petrochemicals? Is that really a focus on BPA and phthalates, or what else?
No, they're not. I mean, I don't think you look at those as petrochemicals. I think it's much more things that are much more directly related to energy.
Okay. So what about air pollution? Is that still important here?
Well, clearly it's important. And the answer really is, I don't know.
Yeah.
I just don't know. I mean, we know that air pollution, although it's much better than it was certainly 50 years ago, even 30 years ago, NIEHS has sponsored such marvelous work in the health impacts and the impacts of air pollution on children's health. I mean, I think of some of the studies that came out from Southern California, looking at different cohorts of children who were born at times when the pollution first was very high and then got better and then even better. And like the lung function was so much better in the children who were born when there was less air pollution. I mean, I think of those studies as being tremendously impactful. I think when the secretary is concerned with chronic disease, I think, I can remember 30 years ago, 40 years ago, all our focus in air pollution was the respiratory system and lungs. And now we know that air pollution impacts lots of parts of our body. We know that our cardiovascular system, we know that our brain. I think that I haven't heard the secretary talk about the microbiome, and I should say microbiomes, but I think he would be interested in work dealing with the gut microbiome when we know how much gut bacteria influence both our nervous and our immune systems and all the crosstalk that goes on there. And we know how much the gut microbiome is impacted by environmental exposures. And how that has such a role. How we know that, for example, obese people have a different gut microbiome than people who are, of, let's just say, more normal weight. But back to the air pollution issue, we know that air pollution, we know that children who are born small for gestational age, and that can be associated with air pollution, we know that those children are at increased risk of overweight by age 10 and obesity by age 20. We know that they are at increased risk of, for example, type 2 diabetes. So I think if you can focus on children's health, chronic disease, I think those things are going to be of ongoing interest. One area I think that NIEHS may not have done enough work on, and is starting to do some, but is chronic kidney disease, which is increasing tremendously in the population. A lot of it is associated with obesity, but there's evidence that different kinds of chemical exposures and environmental exposures may be playing a role in the increase in chronic kidney disease. I think that's an area that the royal we again, that NIEHS has not played in as much. It has a major study now that it's co-funding, and I'm hoping those funds will continue with NIDDK, the CURE study, which is looking at chronic kidney disease in largely agricultural communities in Central America and India. And I think, trying to look at one of the things they're looking at that is the role the environment may be playing in that. I sure hope that those studies don't get tanked, because I think they're really important when we have an epidemic of chronic kidney disease of unknown origin.
Okay, that was really helpful. Let's go back to opportunities. Here's a question. What do you think of the idea of trying to put a human face on these cuts? Because a person with Parkinson's, I mean, this person has Parkinson's, and he says, I feel like my death warrant has been signed. The same is true for so many disease groups. It seems like if we patients would pair up with environmental health researchers and show that real people are being affected, maybe that would have an effect. What do you think?
I think that's the kind of thing you have to do. But I'm going to say something which may, getting that article in the New York Times or the Washington Post or the LA Times or, even the Wall Street Journal that's good. But the place you need to get it is on Fox News and on some of the social influencers, on some of those, because that is the way that a lot of information, a lot of it inaccurate, but also some decent information is being transferred. So I think that we have to be open and willing to dialogue with some people that in the past maybe we weren't interested or we didn't think would be useful. But I think that putting a face on the problem is absolutely essential.
All right. And here's a comment that cuts to the World Trade Center health study actually were restored after advocacy groups pushed for that and asked the president about it. So I guess that's another opportunity that
Yeah, well,
turn
so
some
some of,
things around.
right, so the women's health study that was looking at postmenopausal women that started over about 30 years ago. And initially, that was announced, that study was gone. It wasn't going to be funded anymore. And as of just a day or two ago, that decision has been reversed, and that study is going to continue. So I think informing and pressuring the appropriate Congress people and the appropriate people at the department level can make a difference. In other words, I wouldn't accept everything as they said this is being cut, it's gone. I think you need to fight judiciously for things that are really important. And I would say the long-term health studies, if you kill them now, look at what you've lost. 20, 30, 40 years of research, and it's not something you can start up easily again. So there may be important things to kind of look at. I look at the ECHO program which kind of grew out of the National Children's Study, which was never handled, I would say, kind of appropriately, but it's actually generating lots of great information now. I sure would hate to see cuts in that, for example, going forward.
Since the Make America Healthy Again program seems to be kind of front and center and important, do you have any idea of what the budget for something like that is? Or maybe it even hasn't been developed that far yet?
I have not seen anything. Somebody else may have, but I have not.
Okay. So there are a lot of questions, but many of them are overlapping questions. So I think we've covered pretty much all of the key questions here. So Linda, you did a terrific job. I want to thank you so much. We took you in 100 different directions and you went everywhere and answered everything great. So thank you very much. We all really appreciate it.
Well,
Now I'll
thanks.
turn this back now to Rachel.
One
You want to
question,
say one more thing?
One thing. First of all, thank you for Jerry and Rachel for asking me to do it. And all my friends, I've seen lots of you sign into the chat kind of when this has been going on. Keep up the great work and do what you can and don't give hope, because again, this too shall pass.
All right, thanks. Okay, Rachel?
Thank you so much, Jerry and Linda. And thanks so much to everyone who's taken time to participate today. And thank you for all your excellent comments and questions. A video recording of this conversation will be available on CHE's website soon. We encourage you to support the work of the EDC Strategies Partnership. You'll find links to each member group on CHE's Partnerships page. If you appreciate these webinars, please consider a tax-deductible donation to CHE and/or any of these partners. Many of you may also be interested in joining us for upcoming webinars. On May 15th, the next CHE Alaska webinar will focus on the toxic legacy of U.S. military sites, health and human rights for the people of Sivukak. And next month, on June 24th, please join us for the next webinar in this EDC Strategies Partnership Series, where we'll be discussing changes at US EPA's Office of Research and Development. If you'd like to send us comments or feedback about this or any other webinar, please feel free to email us anytime at info@healthandenvironment.org. Thanks again to all of you for joining us, and thanks to Alyssa Tay, Kristen Schaefer, and Sarah Howard for all of their help behind the scenes.